Hello, everyone. Welcome back to Youthful Medicine. I am Dr. Tahir, a board certified rheumatologist and an obesity medicine specialist. Today, I would like to share with you a clinical encounter that I had with a patient. It's my new encounter with this patient, and she had some real life problems that I wanted to share with you guys and see that if you know somebody who suffers from these type of issues, who are struggling and don't know what to do, there is help. So please do not feel disappointed. Continue to strive for a better health, and if you find this channel useful, please like it, subscribe it, and share it with loved one. So today's case is about a 42-year-old female who is 5'6". Her weight is about 220 pounds, and despite having a really vigorous lifestyle, she continues to struggle with weight problem, and weight loss has been an issue with her. So I want to emphasize the fact that sometimes, in spite of all the efforts, our body weight is not in an ideal range, and that could be because of hormonal issues, and that could be because of genetics. And obesity is a complex disease, so you need to work with a healthcare provider who can kind of help you achieve the goals for better life. So let's break down the key aspects of this patient, and what did I advise her. So obesity and weight loss challenges is common. You would see many patients in your, people in your life, and I see many patients in my practice that despite of having all the healthy habits, they struggle with weight loss. So in this case, this woman is 56 years old, 220 pounds, maintain a healthy weight, and she's a vegetarian. Vegetarian patients, they continue to feel like we are not eating meat, which is high fat, unhealthy, sometimes fried meats, and we are not losing weight. That is another problem that we see. She is very active. Actually, she is a member of CrossFit gym. She works out about 3 to 4 to 5 days a week. Intense workout, high intensity workouts. If you ever been to a CrossFit exercise, I can tell you that it's really a great workout to build muscle and strength, and consider that as a way to maintain muscle mass if you are on weight loss journey. But in any case, this patient is already is a CrossFit athlete. But sometimes, despite healthy habits, weight loss can be challenging due to several factors. As I mentioned, genetic factors, hormonal factors, perimenopausal age makes weight loss harder. She is in that age group where this may be playing a role. From her family side, she said from her paternal side, obesity is also a problem in the family. So it points out towards our genetic disposition. So my advice was that I ordered fasting labs for her, including insulin levels, cholesterol and lipid profile, homocysteine levels. I wanted to make sure that I have a thyroid panel, hemoglobin A1C, insulin. In addition to that, I have ordered C-reactive protein for her, and of course, comprehensive metabolic panel, nutritional status like B12, folate, and vitamin D level. I did mention to her that since she does not have any contraindication, such as thyroid, medullary thyroid cancer, family history of multiple endocrine neoplasia, personal or family history of pancreatitis, that I would be giving her most likely medication called Zepbound, which is the dual peptide GLP and GIP analog for her weight control. It will be most appropriate for her after I review her labs. Continued life support is important. Lifestyle is important, and for this case, I think it wouldn't be a problem because she already has a good, healthier lifestyle, a CrossFit athlete. I do want to emphasize the fact that I would have to work on her on making sure she's consuming a high enough protein diet. Sometimes in vegetarian patients, the amount of protein that they're getting is not enough or not highest quality because of the hindrances of having not all the essential amino acids in the vegetarian diet. So this is something that we'll have to talk about, and maybe I'll have to encourage her to increase her protein intake, maybe introduce whey protein, because for patients who are trying to lose weight, the protein is very essential, and it has to be 1.2 to 1.5 per kg body weight. So grams per kg body weight is essential. So it is, I will calculate her protein consumption. Genetic factors, of course, it is sometimes metabolically problematic and genetically problematic for some people to actually have better weight response. And I think weight gain can also be associated in some patients with their gut microbiome, which is a genetic, also a factor that can play a role in some patients. So she also has also been told that she has high cholesterol. Of course, I'm going to repeat it, but I'm surprised that in spite of her being a vegetarian, well, I'm not surprised, but people would be surprised the fact that even patients who have high cholesterol in spite of vegetarian diet. Why is that? Because we think that vegetarian diet is low in cholesterol. Why is that? That is also a metabolic problem that we see in patients with perimenopausal age, because the lower estrogen level increases the cholesterol in the wrong direction, in the LDL levels go up. So I will evaluate her eventually for the need for cholesterol medication if needed. But in most of my cases, if I am treating their obesity, LDL level starts to go down, their triglycerides levels goes down, and we do not necessarily have to give them more medication. I like to supplement patients with omega-3 fatty acids to help them with essential intake of omega-3s, which are very anti-inflammatories. She also has history of hypertension, for which I would manage. I let her see her primary care doctor so that they can manage it. She's already on 2 medications for hypertension. And of course, at this age, she is not planning pregnancy, so this medication, Zepbound, would not be a problem. But if somebody is planning pregnancies, we do not want them to be on this medication without having 2 forms of contraception, because you don't want people to be pregnant when they're trying to lose weight. But eventually, when they achieve the weight goal, they can become pregnant. So in this case, what I highlighted is the breaking the weight loss barriers. A personalized approach for each patient is important. In spite of that, you are a vegetarian and you are working out and you're not losing weight, don't feel that you are alone. There are millions and millions of patients who have the same problem, and working with a professional physician, healthcare provider, and trained board certified physician who can help you achieve your goals. So that being said, stay active, eat well, and take care of your health. And I will see you in the next video.